Nitroglycerin, or Nitro-Bid, is supplied in 5 mg per milliliter vials. You're going to mix 50 micrograms in 250 milliliters of normal saline to have a final concentration of 200 micrograms per milliliter. The mechanism of action: nitroglycerin is an organic nitrovasodilator that acts principally on venous capacitance vessels and large coronary arteries to produce peripheral pooling of blood and decreased cardiac wall tension secondary to decreased preload. Nitroglycerin, when injected, is denitrated by glutathione S-transferase in the smooth muscle and the vascular endothelium when it's present. The free nitrate ion is released and subsequently converted to nitric oxide, which is responsible for the dilatory effects. Nitric oxide also causes activation of guanyl cyclase and an increase in cyclic GMP. The increase in cyclic GMP donates its phosphate to protein kinase to form protein kinase G. Protein kinase G then goes on to do one of three things. It activates the outward rectifying potassium channel, which allows the movement of the potassium out of the membrane, causing hyperpolarization. It also decreases the contraction of the vascular smooth muscle by binding to myosin light chains and preventing them from contracting, contributing again to the relaxation of the vascular smooth muscle cells. Or protein kinase G can deactivate the inward rectifying calcium channel, which further potentiates the hyperpolarization. The dosing of nitroglycerin is most frequently administered in anesthesia by the IV route, but there are various other routes available. The sublingual route, which is most frequently used for angina outside of the OR, the oral tablet, buccal or transmucosal tablets, lingual spray, transdermal ointment or patches, and like I said, the IV administration. You'll have a loading dose of 25 to 50 micrograms and a maintenance for infusion of 0.1 to 7 micrograms per kilogram per minute. The onset of nitroglycerin IV is 1 to 2 minutes. The peak of IV nitroglycerin is 1 to 5 minutes. The duration of action of nitroglycerin is 3 to 5 minutes. The sublingual route bypasses first-pass metabolism by the liver and is therefore the preferred route of administration outside of the OR. The T half-life alpha, or distribution in the body, or commonly referred to as the plasma half-life, is 1 to 2 minutes. The T half-life beta, or when half of the nitroglycerin is totally eliminated from the body, is 2 to 8 minutes, and the partially denitrated metabolites have much longer half-lives of up to 3 hours. The metabolism is primarily done by the liver and the kidneys. The first products in the metabolism of nitroglycerin are inorganic nitrate and the 1,2 and 1,3 dinitroglycerols. The dinitrates are less effective vasodilators than nitroglycerin, but they are longer lived in the serum, and their net contribution to the overall effect is not known. The anesthetic indications of nitroglycerin is that it is an organic nitrate of choice for the treatment of acute and chronic angina pectoris, symptomatic hypertension, and congestive heart failure. It is also used to rule in or rule out acute and recent myocardial infarctions. Nitroglycerin is effective in producing controlled hypotension because it acts predominantly on venous capacitance vessels and decreases preload. Other effects of nitroglycerin include relaxation of bronchial smooth muscle, relaxation of gastrointestinal smooth muscle, particularly the sphincter of Oddi, and relaxation of esophageal and uteral smooth muscle tone and cerebral vasodilation. Anesthetic contraindications and concerns. Severe hypotension and shock may occur with even small doses of nitroglycerin and should be used with cautions in patients who may be volume depleted or who are already hypotensive. The effects of nitroglycerin can be potentiated by alcohol, phenothiazines, calcium channel blockers, beta-adrenergic blockers, antihypertensive drugs, and other nitrates. It may also affect heparin and coumadin, as well as an inhibition of platelet aggregation through the same mechanism of action that causes vasodilation. Nitroglycerin IV should be administered only via an infusion pump that can maintain a constant infusion rate. Nitroglycerin also readily migrates into many plastics, including the polyvinyl chloride, or PVC, plastics common in administration sets. It is recommended to use the commercially available non-absorptive administration sets that are available to reduce complications. With extended long-term use and exposure to nitroglycerin, tolerance can occur, so patients who are taken off long-term use should be monitored closely for chest pain, acute MI, and even sudden death. Overdose of nitroglycerin generally amplifies its effects on capacitance vessels. The symptoms may include decreased intracranial pressure, throbbing headache, confusion, moderate fever, vertigo, palpitations, dyspnea. Nitrate ions liberated during metabolism can oxidize hemoglobin into methemoglobin. Here are some useful links that you can click on to get some further information on alternative uses of nitroglycerin and a little bit about the protection against ischemia. And here are my references. This concludes my presentation, and at this point I am subject to your questions. Thank you.